There was a time in India when, and even today I would say, our society, largely speaking, is terrified of the word surgery. And I can understand why. The reason for this is that after independence, immediately for the first 40 years or 50 years of our existence as a society, we were relatively speaking a poor society. There were, of course, a few rich men around, but the vast majority of us were quite impoverished. And as a result of this, the society could not afford to have professional quality hospital platforms. It is now, with the passage of time, that we are poised to become an economic superpower. And we can see the signs of wealth all around us, and therefore we are able to now afford higher quality hospital treatment. And it is this affordability which has allowed modern hospital platforms to be built in this country. Welcare Hospital of Vadodara is just one such example. We have attempted to create a 100-bed state-of-the-art facility with multiple operation theaters, with the latest of technology that the world has to offer. And how does this help? This helps by creating a very safe and predictable system for patients to undergo a surgical procedure. Moreover, instead of the one-person nursing home that this country has seen up to now, a large platform like ours, where there are multiple doctors working. For example, I am leading a team of 100 doctors and paramedical staff under me. These multiple orthopedic surgeons, physiotherapists, internal medicine doctors, medical officers, and ancillary staff, all these put together offer our patients a level of security and safety which a nursing home can never offer. And that is why we are able to now deliver results as if it is mathematics. I would like to convey to the society at large that a surgical procedure is not a risk-taking action. It is a highly predictable action. You will be pleasantly surprised at the lack of pain or tension that you will have to go through. And I would like to show some examples of how easily a patient can go through a major surgical procedure without feeling pain or distress at any point in time.
मेरे को 94 से तकलीफ है। मैं चलता था तो मेरे को दर्द होता था। पहले एक पैर में हुआ, फिर दूसरे पैर में हुआ। वो मैंने डॉक्टरों को बताया, करा, एक्सरसाइज भी करी। उन्होंने डॉक्टर को बताया था, मैंने तो उन्होंने एक्सरसाइज भी बताई थी, वो भी सब कुछ करा। लेकिन मेरे को ज़रा सा भी आराम नहीं हुआ। वो बस गोली लेता था तो थोड़ा सा पेन रिलीफ होता था, उसके बाद में फिर दुखने लग जाता था। तो मैं कंटिन्यू गोली लेता रहता था। धीरे धीरे बढ़ते बढ़ते 99 के बाद ये हालत हो गई कि बिल्कुल कंटिन्यू दोनों पैरों में दर्द रहने लगा और मेरा चलना मेरे को बहुत मुश्किल जाता था। डॉक्टर भरत मोदी का वेलकेयर हॉस्पिटल इसलिए चुना कि वहाँ पर सिर्फ घुटने का ही इलाज होता है, घुटने का ही अन्य सर्जरी होती है। इसलिए इंदौर में भी बहुत जगह थी, लेकिन मैंने इंदौर में, क्योंकि यहाँ कभी सभी ऑपरेशन होते थे और वहाँ रेगुलर होते हैं, डेली होते हैं ऑपरेशन, इसलिए मैंने वो वेलकेयर हॉस्पिटल चुना। वहाँ पर किसी प्रकार की कोई तकलीफ नहीं। जो अटेंडेंस आते हैं उनको कुछ भी नहीं करना पड़ता। सारा जितना भी मरीज़ का जो जितना भी काम है वो सब वेलकेयर हॉस्पिटल के स्टाफ मेंबर ही करते हैं और वो बहुत अच्छी तरह से उनकी देखरेख करते हैं और उनको संभालते हैं, वहाँ की सर्विस बहुत अच्छी है। जो काम ऑपरेशन के पहले जब मेरे घुटनों में तकलीफ़ थी और जो काम नहीं कर पाता था, वो सारे काम मैं अब आसानी से कर लेता हूँ। मेरा आना जाना कहीं भी बिल्कुल बंद था, सिर्फ घर पे रहता था और यदि कोई ज़रूरी होता तो ही जाता था। अब मैं सब दूर चला जाता हूँ, मेरे को किसी प्रकार की कोई तकलीफ नहीं और मैं बहुत ही ईज़ी महसूस करता हूँ। कोई तकलीफ नहीं होती, कोई परेशानी, कोई दर्द नहीं होता, कुछ नहीं होता। ये है कि एक महीने 1.5 महीने 2 महीने फिजियोथेरेपी करना पड़ती है और वो फिजियोथेरेपी करने के बाद में अपन जैसे नॉर्मल लोग रहते हैं उस हिसाब से अपन वापस चलने फिरने लग जाते हैं। इसमें कोई किसी प्रकार की कोई तकलीफ नहीं होती। ये है बस खाली लोग ऑपरेशन के नाम से डरते हैं, इसलिए वो ऑपरेशन कराने में लोग हिचकिचाते हैं।
I've had rheumatoid arthritis for about 20 years, and over the past 5 or 6 years, have had a lot of pain in my left knee. And earlier this year, I had an incident where I landed up in hospital. And when they took x rays, they said that I needed to have a total knee replacement. I feel so much better. I wasn't able to sit. I wasn't able to stand without a walking stick. It would take me many seconds just to get in my chair and out again. And for the first time in a long time, I'm able to just stand up and I'm able to walk without my walking stick. So I'm going to pack my walking stick in my suitcase and I'm not using it anymore. The medical care that I've received here at Welcare has been equal or better than anything I've had done in any other country, including South Africa. As I've said before, the quality of the medical care, the nursing, the physiotherapy, and even the surgery is comparable with anything I've experienced anywhere else. I would absolutely recommend anybody that I love to come back to India and have their surgery done. The thing that's really amazed me is how quick I started to move again. I couldn't believe within days I was walking, and a few days later I was walking without my stick. So I think the thing that's really, I never thought I would get active that quickly. Within the last few days, we've been going on some city tours. We've even been going every day on the rickshaws, touring the city. We went to the palace yesterday and we've had a wonderful time. To do it as soon as possible. There's no point in suffering a day longer than necessary. Get the surgery done and you'll be on your feet within days.
For last couple of months, for my age I used to overstretch myself playing tennis and various other activities. Then I thought my activity was getting hampered, mainly mobility. Mobility had come, 70% off and resulting into fatigue and pain. So these were the main complaints, lack of mobility. That was the main complaint. Well, I personally had the experience. I was admitted a day before and I was given a total good counseling and 100% assurance that things are going to be fine and nice. And let me tell you, when I was taken to the operation theatre also, I went with the full confidence. And when I came out, of course, after the operation, pain is always there for the time being. But then I was made to get up on I would say about 40 hours after my operation. With difficulty, I made myself up. And with clutches, I started walking. And on the third, I was used to walk with my clutches. And on the fifth day, with a stick. And on the sixth or seventh day, without stick, I was there. So I think my own experience was very good after the post-operative surgery. And of course, everything that helped me was good counseling, good advice, and good confidence that I was given. And excellent ambience in the hospital. That also played a very important role. The staff that is there in the hospital, that also plays a very pivotal role. The trained qualified nurses, the paramedical workers, they all have supportive approach. And what ultimately gave me a good relief was the physiotherapy after the operation. So physiotherapy also has played a very important role. After my operation, I continued with my all activities except that I've stopped my medical practice. I do my regular morning walk. I do little cycling twice or thrice in a week. I go at times for swimming once or twice in a 15 days. I swim for about half an hour and various activity. I keep on moving all throughout the country. Technology is developed. People are taking advantage. And if you want to make your life and totally life to be transferred, I think you should go safely for the operation. If you want to have a good quality of life and total transformation of your own self to make your personality more effective and efficient, you should go for the operation without any fear or without any reservation.
Our team of doctors at Welcare Hospital is passionate about providing the highest quality of medical and surgical care to our patients. But over and above this, Welcare Hospital and its administrative team are equally focused on providing the highest quality of cashless facilities, high quality of catering services, and also excellent physiotherapy facilities. We also run a charity ward which helps the poor and the financially disadvantaged citizens of our society.
We at Welcare Hospital consider ourselves really blessed that patients have entrusted their life and limb to us, and these patients are not only from our beloved city of Vadodara but also from the whole of Gujarat, indeed the whole country, and from across the world. And these patients are not simply the ordinary citizens who are seeking value in terms of coming to a small city. We have been lucky to have the confidence of Prime Minister level patients like His Excellency the Prime Minister of Fiji Islands, Mr. Sitiveni Rambuka, who came all the way from Fiji Islands to get his knees replaced at our hospital, Welcare Hospital in Vadodara. And we have regularly had the faith of religious leaders of our country from across the spectrum of religions, from artists, from sports people, whom it is even more important than the routine citizens to make sure that their limbs and joints work well after a surgical procedure. So Welcare Hospital Vadodara should be, and we are, indebted to our patient population who have reposed faith in us from across the world.